Thank you for coming to join us at the World Health Organization, Gary and Charlene, on the occasion of the 2015 World Mental Health Day. To start off with you, Gary, if we go back a few years, the starting point was when you had a bout of depression yourself back in 2009.
Yep.
Can you tell us a little bit about that time?
Yep. I suppose the events were going on for a number of months previous to me kind of having, hit rock bottom, which was around September in 2009. So I would have been experiencing a lot of stress and pressure from work. So my business life was hectic at that time. I was also probably drinking too much. And all of these kind of add together and culminate then in, I suppose, somebody having a depressive episode or being suicidal, which in my case, that was the case in my case. So it kind of built up over a few months. It's never one thing or one event. I didn't really become comfortable, I suppose, speaking about mental health or the fact that I had depression, maybe for a couple of years. And really, the recovery, I suppose, took a long time too. I'd obviously built myself up into being depressed, as I say, over a number of months, maybe 8 or 9 months, from when I really started to feel that something wasn't okay. I obviously deny it a hell of a lot. Particularly, I suppose, males probably deny it even more than females would, because you don't want to seem vulnerable or seem like that you have some kind of problem.
And when you initially went to seek support and see a general practitioner, what sort of support did you get?
He was excellent. The GP was excellent. There's always, well, I suppose for most people, there's the fear of what people will say. Particularly looking at people in my life, family, I would have been very anxious about telling them. Obviously, your partner will always know, so she knew. Even before I was to say anything, she would have known. But people like your father and your mother, who would be from a different generation, it's very difficult for them to understand. But visiting the GP was probably one of the best moves I've ever made. Obviously prescribed antidepressants because he knew kind of at what level I was at, but also then offered ongoing support. It wasn't just a case of, here's the medication, go off.
And in Charlene's case, so Charlene, you were diagnosed with schizophrenia almost, I think, a couple of decades ago now. Can you tell us a little bit about that time?
The first time I was diagnosed, when the psychiatrist actually told me I have schizophrenia, I never heard of the word before. So it was very scary for me to actually hear that word. And not that the doctor at the time actually told me what it meant. I actually had to physically go to a library and go read up on what does this mean, all he gave me was a very poor prognosis. I first started experiencing symptoms in 1991. I think a lot of stigma and discrimination prevented me from actually seeking help and actually from admitting that something was wrong. I remember I just finished school, so I started working, and when I started experiencing symptoms, there was a part of me that kind of knew something was wrong, but at the same time, I didn't know exactly what was going on. Only until my behavior became so dramatically different from what it used to be that people started noticing something was wrong. Luckily at the time I was working for a medical doctor who actually encouraged me to seek help. Which I did very reluctantly. After that, I was numerous times with medication. I was for 9 years. It took me literally 9 years to get to the right type of medication that kind of stabilized me. If I kind of calculate all the time I spent in psychiatric hospitals was 4 years. Then I spent 2 years in a psychosocial rehabilitation facility in another city than where I came from. In terms of support, my family in particular, I think in the beginning they were very opposed to the diagnosis. They kind of wanted to blame something else. Was it substance abuse? Was it Satanism? It took them 15 years actually to come to the point where they became supportive. But I contribute their lack of support to stigma, discrimination, as well as their own ignorance. So my whole life was facing no hope, no future. Perhaps that was also why none of the medications I was tried on didn't actually work, because it didn't come from my part. I always say that medication contributes a certain percentage, but not everything. A lot of it also comes from yourself.
Going back to you, Gary, you talked earlier about the importance of support from your general practitioner and your family. You also talked a lot about sport as a huge support to recovery.
So I was a strong man previous to getting depression, and then when this happened, I felt my whole core was just crumbling, because I was, those questions of how could this happen to me, how could I allow it to happen, all of that stuff. So really for the first few months of being on medication and being really seriously depressed, you definitely 100% do not want to go outside. So it's very, very difficult to just make that first step, because you feel safer inside somewhere. You don't need to deal with any people, you don't need to talk to anybody, you just need to, I suppose, take your medication and sit around maybe feeling sorry for yourself. Now at that time as well, I was smoking, and smoking heavily. Again, something you do as you sit around taking medication and not really having anything else to do. But I said I'd start and see how I got on. And for the first maybe 5-6 months, it was horrendous in terms of my ability. And it was a little bit frustrating. But the one thing I did notice was I was starting to get little achievements. So my first achievement was maybe 1 kilometre. And that gives you a little boost of self-confidence. I just knew that something was happening that was kind of building my strength back up, both physically and mentally. And I set myself the goal to run the Dublin Marathon again. So it gave me something as well to aim for. And it started to stop me smoking as well, which is obviously another health benefit. The most important aspect of it was those little goals. And just hitting that 1 kilometre, that 5 kilometre, that 10 kilometre, it's massive in terms of somebody who has come, because your core is shaking. So running just started to build that up slowly for me as I went along. And getting out into the fresh air. Removing myself from that little small room, and just seeing things, seeing normal things that you would on a day-to-day basis. Again, just feeding better thoughts into your brain, as opposed to sitting there worrying about silly stuff.
Okay, thank you very much. And both of you went on to become mental health advocates.
I think the big reason why I actually became an advocate is because of abuse, both physical and verbal abuse that I experienced within psychiatric hospitals, and the patients just accepting it as part of the package of being mentally ill. And to me that was wrong. So I also had to take little steps to first fix myself before I could fix the world or other people. So volunteer work was one step for me. And then I was offered a full-time position in a provincial organization. There my job was basically to start up a consumer advocacy movement, which I did and became quite successful at that.
From what you've seen over the last few years, what do you think still needs to be done in terms of ensuring that people who are being treated for mental health illness are treated with dignity and respect?
I think there's a huge lack of seeing people with mental illness as fellow human beings, who are capable human beings, who can speak for themselves, make their own choices regarding their own lives and all aspects of their lives. The perception society has, especially with schizophrenia, immediately you are perceived as being a danger, you need to be locked up, and that's incapable of being employed, being educated and all that. I think changing people's attitudes in society is not an overnight thing, so it's a long-term process, and I think service users play a very important role in that process, in sharing their stories to the public, for them to see, to physically see people with mental illness are like anybody else.
I'm actually going to ask this very similar question to Gary. Do you feel that attitudes among the general public towards mental health illness are changing?
Yeah, absolutely. I think from big campaigns, just speaking from Ireland's point of view, the big campaigns that we have on the go now, and for example the Green Ribbon campaign, so the whole month of May you will see thousands of people walking around Ireland wearing green ribbons, and it just starts a little conversation. So people ask, you know, what's this green ribbon about, or what's this mean, or what's that mean? And it's really just trying to bring mental health down to a very basic level of, you just need to ask, how are you? And it's just starting that conversation is really why I started to get involved with Sea Change, because they want to break down that stigma. So stigma, as Charlene mentioned, is one of the probably the biggest issues somebody has who's dealing with a mental health problem, because they're not sure if they come out and say this what the reaction is going to be, they're not sure what support they're going to get. So one thing I always say to people, if it was 5 or maybe 7 or maybe 10 years ago, I wouldn't be talking about mental health in Ireland. I wouldn't be in the paper, I wouldn't be on TV. You just wouldn't get that opportunity, and now people have that opportunity. So you can see the change happening. There's a long way to go. There's still a lot of discrimination, still a lot of stigma. There's still a lot of people who are living alone without coming out and saying what they're feeling or what they're going through. But I think people's attitude, and I think that's the core thing, if people's attitude change, we can do anything.
And you've obviously both come a very long way and achieved a lot in the last 10 years or so. What future goals have you got?
I think I've got this big dream to empower more service users to achieve to the level where I am, so that they can continue. I would really like to improve the quality of life for people with mental illness, for them to realize that they are a human being, they don't need to be afraid of anything, and they are entitled to dignity and human rights.
Thank you very much. And to you, Gary, what comes next after the North Pole Marathon?
Oh, God, I'd be afraid to say on camera, because if my wife sees it, she might kill me. But I suppose around mental health, it's just make an environment whereby it's okay for, say, my kids to feel really comfortable about discussing their mental health, about asking for help. I mean, that's really what I'm trying to do, so that the next generation, they don't have to deal with stigma or discrimination.